As you have no doubt realized by seeing the video of Sam in this series, video captures symptoms and their impact on daily living in a powerful way. Video captures changes over time in the participant's daily life and natural environment.
I mean, it wasn't actually smoking, but it, like
Video can reveal not only behavioral and symptomatic changes that may or may not result from an intervention, but also whether the participant's quality of life is improved.
It smells so good.
Sam is participating in an important natural history study of familial dysautonomia, or FD, at the Dysautonomia Center at New York University's Langone Medical Center. The study measures data on all aspects of FD with a focus on two significant symptoms: the loss over time of cells within the eye, eventually causing blindness, and the deterioration of walking ability and balance.
Very short, just around the corner, right?
Here's why this is important. By studying the progression of these two symptoms over time in a natural history study, researchers can establish outcome measures and biomarkers, which are objective measures of a patient's condition. These outcome measures allow researchers to test whether a new drug or intervention is working. In this episode at the Dysautonomia Center at NYU, our media team filmed the yearly examination of two individuals in the study, Diana and Piper. But this is an example now of something we did. We went to familial dysautonomia lab, and we were invited to film two examinations of children.
How old is she?
Diana is 8, I believe.
How are you doing?
Diana, I'm just going to put this little tube inside your nose to measure your breathing. Okay? It's not...
At the center, we've been following patients with familial dysautonomia for almost 50 years. So the natural history study went from one clinician keeping paper records to eventually evolving into a workable database so you can answer questions on a day-to-day basis about the disease and about the patient themselves. We try to see each patient with familial dysautonomia at least once a year for what we call a comprehensive evaluation, so it's kind of top to toe.
Here, open the ah.
Big.
Nice big ah. Good job. Show me your teeth. Nice big smile. Close your eyes tight. Open your eyes. Okay, raise your eyebrows. Good job. I'm just going to take a quick look at your G-tube, okay? I'm not going to move it. Any pain in your tummy?
Stand up. Slowly.
Up. Careful. I'm on top of you. All right, Diana, good job. Good job. You want to hold on to me a little bit and I help you?
So we're following each of the organ systems on a yearly basis with a specific battery of tests that allows us to see how different symptoms and different features of the disease evolve over time. And slowly that builds into a data bank that not only supports the research progress, but also supports the clinical care of the patients, because you start being able to use this information to look at common complications, what's the outcome of certain treatments for better or for worse, which has been the basis of a number of research studies that we've had to understand pressing issues that these kids have, like early onset renal failure, sudden death during sleep. I mean, we've been able to identify cases where that happened and compare them to cases where it did not, and help us understand risk factors, right? So we can change treatment as time goes on using the natural history database. So that's one aspect that we use it for. The other aspect, of course, is developing treatments and figuring out what changes over time in these patients, because there are certain features of the disease that they're born with, and there are certain features of the disease that appear as they age, such as difficulty walking or difficulty with vision. So the natural history study also tracks those aspects of the disease, which we can then use in clinical trials to see if we can make those things better over time, to see if we can find treatments that are targeted at the core of the disease process that slow down some of the degenerative aspects.
Like this. Okay, that's good. Good job, Piper. Okay, you can come back.
In terms of is it useful to monitor the parameters over time and watch how they change? Video is incredibly important for that. For a number of different reasons. I mean, we know that their gait is not necessarily perfect, right? They have some subtle abnormalities, but they are able to walk independently. And then as they age, that gradually changes. But it is, fortunately for them, it's somewhat of a gradual change, right? It doesn't progress as rapidly as some other diseases. So you can't necessarily capture it in one visit from another in 1 year's time.
And when you're ready to turn around,
So what you really want to be doing is following those features over time and looking at them in different intervals. And one of the things that we're doing with the video is that we're showing video recordings of patients at different ages to movement disorder specialists, because no one scale for capturing movement is perfect for FD, because it's a sensory ataxia combined with other defects in the motor coordination area. So it's so multifactorial.
1, 2. That's why I know someone just messaged me. 3, 4.
We're taking these videos of the little kids, of the teenagers, of the older patients, and the ones that are, in their 50s and 60s, and saying, look, this is the pattern of how these patients evolve over time.
We got all excited when we saw the packages.
And it's really powerful to be able to show that in images as opposed to just descriptions. And then you start having these conversations with movement disorder specialists that tell you, well, you could potentially modify the scale to capture things in a more sensitive way. So you can eventually, you can map the changes more quickly. So I think the video is incredibly useful for that. You can interact with the footage, you can see the different phenomenology at different ages, and eventually you're able to go back into the video knowing how the patients evolve and look at the younger cases and see more subtle signs that are potentially scoreable on scales that you can use as features of the disease that are evolving early on into significant motor problems when the patients age, yeah.
okay, I want you to turn your head to your left. Good. Now turn your head to your right. Good. Now shrug your shoulders up. Strong, strong, strong. Okay, good. I want you to show me how strong you are. So go like this. Yes, good for you. Now don't let me push you down. Don't let me push you down. Stay strong. Up, up, up. Go like this. Up, up, up. Strong, strong. Oh my goodness. Oh my goodness. Okay, arms up like this. Push against me. Push, push, push. Good job. Okay. Squeeze, tight as you can. Squeeze, squeeze, squeeze. Squeeze, 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 squeeze. Okay, good. Don't let me take my hands out. Here, come. Go ahead. Hold my hand. Squeeze, squeeze, squeeze. Tight, tight, tight. Good job. Good job. Let's see. Good job. Squeeze, squeeze, squeeze. Okay, good job. Now, does this feel the same? Feel me touching you here and here? Do you feel me touching you? Okay, actually close your eyes. Tell me if you feel me touching you. Say yes. Yes? Okay, good. Okay, here we go. Now, I'm gonna touch your cheek, okay? But you tell me if it feels hot or cold, alright? So here. What do you think? What does it feel like? Hot or cold? Cold? Okay. Keep your eyes closed and tell me what you feel. Hot or cold?
Good.
Okay, how about here?
Good.
Alright. How about here?
Good.
And here? Okay, good. Okay, now this one is going to be a little sharp. So you tell me when you feel it, okay? So here we go. Tell me when. Tell me when you feel it.
Go.
Well, do you feel it sharp? Is it sharp?
Is it poking you?
Yeah. Do you feel poke? Do you feel something touching you? Is it sharp, like a pin? Yes? Okay, tell me what you think. Is it sharp? Say sharp or dull? Sharp? Sharp or dull? Sharp or dull? Sharp or dull? You feel it? Which finger? Yeah. Okay, good.
I mean, here's the whole thing in terms of video natural histories. The fact is that you, Adam, you, Amelia, you, Louise, were right in this room with this child.
Yeah.
Right?
Yep.
And then there's the whole thing about this was, you know, in many of the video natural histories you've done, you've been right there with the family, outside, inside, whatever.
Yeah.
What was there any impact at all in terms of this child as far as you all being there?
What do you all think?
It might have been a little bit more stressful, I think, because there's a lot of people packed inside that room. But I don't think there was too much, like the parents and everything seemed pretty okay with us being there.
Well, I'm wondering though, if Piper were one of these people you were doing video natural histories on and you had started out, you know, a while ago, that then this whole process of now being in an examination would have been a whole nother scenario because it would be very comfortable with you being around, and so would Piper.
That's actually a point that they make a little bit differently, but exactly your point. They say in some cases the children are too young to take certain tests that are needed for the natural history,
Yeah.
but they have them come in and walk them through anyway. So with the next year when they come and they're older, they are veterans at doing this. So it's just what you're saying, giving them the experience and taking the tests every year helps them to be more relaxed and makes it an easier time.
So when we see a patient with familial dysautonomia on an annual basis for a comprehensive checkup, we have a systematic group of tests that we've designed, that we've refined over the years to be able to capture the multiple abnormalities that they have in the fastest amount of time with the most sensitive measures we have. So with many of the young children, we will start them early going through tests of blood pressure, tests of breathing, tests of neurological function, so they get used to having those tests done, so it doesn't become a great surprise for them when somebody suddenly, says, look into this camera because we want to measure your eye. We'll start off many times just getting them used to sitting in the chair, looking in the lens, focusing on the dot, so that when we are ready to start treatment trials, the child already knows or is already accustomed to going through these sort of assessments, so it's not so traumatic for them.
I felt that with Diana. She didn't seem that concerned with us.
I mean, she glanced at the camera a few times, so she knew we were there. She knew what was going on. But yeah, she didn't seem to pay much attention. Whether she's being her true self, I think, is a more difficult question. We're just one variable.
And that's the advantage in our process, when we can do it, of filming at home. Filming at home, filming at school, because now you're getting a chance to see the impact of testing and be able to kind of gauge, and you can get a better sense sometimes at home of receptive language skill and how good that is at home because they're the most relaxed and they're used to listening to mom and dad and sisters and therapists who visit and like that, so you can really, oh yeah, they really get that. But with her just doing the exam room, it was hard to know.
Okay?
Love your glasses, Piper.
What do you say? Do we take them off our face?
Only at night.
Oh my god.
Where's your song?
Oh yeah, you want to sing your song? Let's sing it. Ready? The more we get together, together, the more we get together, the happier we'll be. You gotta look at the camera, ready? Because your friends are my friends and my friends are your friends. The more we get together, the happier we'll be. Yay! Good job.
That's a great song.
You like that one? Don't pull on your shirt. Don't pull on your shirt. Wow. Let's put it here. This is going to give you automatic hugs. You ready for your hugs? Okay.
How many?
A few. A lot of hugs. Okay, you're just going to keep your arms straight when it takes a read, so you can touch your knee. Good job.
What is that?
Stickers. Do you like stickers? Do you want to be a robot?
No.
Should we turn you into a
Can you
robot?
do your robot dance?
No, with a... Do you want to put the stickers on?
Let's make you a robot.
Because they're going to measure your
No,
heart.
I don't want it. I
You-
don't
I'm-
want it.
You don't. They're like this, and you peel off the back. Stick. You want to touch it? Yeah. Touch it. You can touch it. Stick. Sticky, right? And then if you put them here, we put one here, and one here. And it lets you see the activity of your heart. You want to see your heart beating? Right. Yeah. It's really cool.
Why do we have to do the tissue?
So you don't get dirty. Yeah.
Tissue helps keep you clean because they're gonna put a really little gel.
Yeah, I'm gonna put some like a little
It's like wet.
ultrasound gel.
It's like
You'll
wet.
feel it.
Like when we took the pictures of your kidney, remember?
Do you remember that? Here we go. Do you feel it?
Is it going dry?
Yeah,
Is it gonna,
Yeah.
It'll dry, but I'm gonna wipe it off. Ah, there we go. Tiny, tiny, tiny bladder. Piper pressing in.
You okay?
You doing all right?
I'm trying to get her blood pressure at the same time to save her a little time. You gonna stand up for me?
I'm done. I'm done with that test part.
Good job, Piper.
You want her to stand up?
Yeah.
Okay, Pipes, ready to pop down? Boom.
Right.
Good job. Okay, do you know what we're doing?
Like,
I don't know. Let's ask them.
what are we going to do?
We're gonna go ahead, place this over your eyes, okay? And you're gonna look through one eye at a time. Okay? Go ahead and grab this. Put it right over your nose. Excellent. A little bit more this way, like that. Okay? Can you see out of one eye? Very good. Here, let me grab the tissue. You're gonna read the numbers on this little book, okay? This one here?
What?
Excellent. Do you know this one?
7.
Very good. This one here?
What?
This one? You don't know it?
Yeah.
Take your little finger. Go ahead and trace it. Draw it. Very good.
Why did you say go down?
Exam? Because I'm gonna examine your eyes. Hold on, I'm gonna bring you up. Don't worry. Make sure you don't get squished. Oh my goodness. Try it. Oh my goodness. We're right where we need to be. Okay, now lean back.
Okay, relax your neck. Relax your neck. Shake it up, shake it up, shake it up.
Okay, I need you to lean back. I'm just gonna, no, don't look, look up.
Look at Daddy.
Look up. Look up, no,
Look at Daddy,
don't
though.
look at Daddy. Good job. Let's see.
Look up
at
at the
Daddy.
ceiling. Look at the ceiling.
Look at Daddy.
Good job.
Good, close your eyes. Open your eyes. Ooh, okay, all right.
We use video in the patients in the natural history study a lot, because they can have episodes of, for example, collapse or unresponsiveness, and that the parents can be describing, and in the back of our minds we can have like 4 or 5 different things. It could be this, some more likely than others, right? So many times we will ask the families, when this happens, please take a video, right? Because then they can be your eyes on the scene and you capture the phenomenology. And those videos coming in, we'll review, we'll see were there specific movements that were associated with a seizure versus low blood pressure versus a behavioral issue that somebody may be having, right? So with that sort of visual information, you can understand, along with the parent's description and many times the patient's description, a little more of the phenomenology. So video is incredibly useful.
Like this. Okay, that's good. Good job, Piper. Okay, you can come back.